Hi listeners, Jason here. We are excited to finally announce registrations for the biggest psych health and safety community event ever. The inaugural The Psych Health and Safety Conference will be held at the Sofitel Wentworth, Sydney, June 19 to 20, 2024 and offer concurrent virtual attendance. It'll feature live podcast recordings with OG researchers including Christina Maslach and Michael Leiter of Burnout fame, Psych Health and Safety USA podcast host I. David Daniels, Australian super experts including the likes of David Burrows, a special 10-year anniversary integrated approaches to workplace mental health panel with authors Tony Lamontagna, Angela Martin and Kat Page, hand-picked case studies from organisations doing it well, and a very special interview with plaintiff Zagi Kozarov by Catherine Dunlop on that High Court case which we previously covered on the podcast. This event will sell out. Get in quick to secure tickets at early bird prices for the 2-day conference, pre-conference masterclasses, and the VIP dinner. The first 200 in-person registrations also get a copy of her latest book, The Burnout Challenge, signed by Christina Maslach herself. Find out more and register at www.psychhealthandsafetyconference.com. Now, on to this episode.
While the United States may not have a law on the books requiring organizations to address workplace mental health, there is a national organization that's created a more positive approach in the form of an award for those who prioritize the mental health of workers. We'll learn more about the award and talk workplace mental health up next on this episode of the Psych Health and Safety USA podcast. From Flourish DX, this is the Psych Health and Safety USA podcast. As workplace mental health has become a global priority, there's a greater focus on addressing psychosocial hazards. Each episode, we look at psychological safety from an occupational health and safety perspective. Let's talk Psych Health and Safety. Welcome to this week's Psych Health and Safety USA podcast. I'm your host, Dr. I. David Daniels, and I want to thank you for tuning in. Each week, we seek to increase awareness of the importance of psychological health and safety by learning from the lived experiences, research, and expertise of our guests, as well as advocating strategies to reduce harm and minimize vulnerability to psychosocial hazards in the American workplace. So we have lots of conversations on this podcast about the challenges associated with being in a country that doesn't have requirements around addressing psychosocial hazards, addressing mental health. It's a conversation that has really been at the foundation of these discussions each week. And so we often talk about what makes us different from the roughly 40 countries around the world who require this. But I recently found out that there is another approach being taken. Instead of trying to require people to do it, which someday we probably should, but there's actually an incentive structure for folks who have already figured out that this is important, and there's an award. And I was discussing with my guest, who will be introduced here in a second, that as much as I consider myself to be into this topic, I wasn't aware that there was an award, and it's really good to know. So we're all going to learn a little bit today, or at least I will, more about the organization, about the criteria for the award, about kind of why they give it. So let's open up the conversation with, it's not really a patented question, but it's one that I tend to ask people. And the question is, who is Suzi Craig?
So I am VP of Workplace Mental Health at Mental Health America. And I have been at Mental Health America since June of 2023. So not quite a year. Before I was at MHA, I was at Mental Health Connecticut, which is one of MHA's affiliates. And I was our chief strategy officer at Mental Health Connecticut. We have 143 affiliates across the country. And then Mental Health America is the national mothership, if you will, based in Alexandria, Virginia. We've got a staff of about 50 folks, and we've been around for 115 years. So, yeah, been around for a hot minute. I came into the mental health field through my work at Mental Health Connecticut, and that was, like I said, about 8 years ago. Before that, I wasn't in the mental health field. I'm not on the clinical side. I am on the strategic planning, marketing development. I've been working, on and off for nonprofit, for profit. I was in the startup industry. I've been in a bunch of different arenas. Once worked for public radio. So yeah, I've been all over the place with where I've worked. But I've always tried to find places to work that I knew I could be passionate about and that I could be personally supported, and where I could really find my people, if you will, and have that, passion connection for the work. And I say that, kind of as a segue into, what, I want to talk to you about, is which is worker well-being, and how passionate, Mental Health America and myself, and a bunch of us are around making sure that the workplace environment, um, really steps up its game, right? There's a lot of ways we can take this conversation, but I think everyone can nod their head around the fact that it's time for workplaces to really own, and be, a more active player in the lives and the support and the health and well-being of individuals.
Absolutely. Well, that's exactly where we want to take this. One other kind of standard question I ask folks. So, what does psychological health and safety, when you hear that, what is that?
Oh, that's a great question. Well, I think the light bulb moment for me when, I started a workplace program when I was at Mental Health Connecticut. Um, the light bulb moment for me was thinking about how to define psychological safety in the workplace and redefine the idea of workplace safety, right? So if you think about OSHA and you think about safety from that lens, they obviously have a lot of guidelines and rules around enforcement as far as slips and falls and making sure you're wearing the right shoes and right all of that kind of good stuff. And OSHA does have some, I don't even know if they're really considered guidelines, but they attempt to make psychological safety, a priority. I would love to see them do more around that. But I encourage workplaces, employers to think about redefining what safety means in the workplace, right? So if you are, with your coworkers, with your manager, with, C-suite, whatever the structure looks like, is the workplace environment itself, has there been, you know expectations and really an open conversation around how do we engage with each other, right? So what are the values of this organization that allows for me to feel safe in this conversation, right? And for me to be able to, truly share what I need to share so I can get what I need, right? Um, and that looks different for everyone. As a white cisgender person in the workplace, I have different ways that I need to put my listening brain on folks coming from different backgrounds and different communities with different skin colors and different orientations. They're going to have a different level of safety in the organization, and I don't know what that is because I'm not those people, and right, but I need to know what that looks like, right? So has the leadership of that organization done its job to ensure that as individuals, as teams, as an organization, you are setting the stage for folks to have those conversations, right? That are truly hard and challenging, and they should be, and we're not shying away from that, right? So Amy Edmondson from Harvard actually coined the definition of psychological safety, which I don't have in front of me, but there's a piece in that definition where she talks about interpersonal risk taking. And I think it's a really interesting phrase. If you think about that, can do I feel safe enough to take a risk in this conversation to say, hey, I'm struggling, I need a mental health day, or I had an experience with you that to me was a microaggression or a thing or a this or a that, right? Is the environment created in such a way that people can have those conversations?
Right. Right. Wow. Okay. This is going to be fun. Again, you and I are having a conversation for the first time and meeting for the first time. So I'll share with you that my research was around psychosocial hazard mitigation and this view. So when you look at the Occupational Safety and Health Act, it has 19,700 or so words. It mentions psychological twice. It wasn't built to consider the psychological health and safety of human beings. It just wasn't. And it's not to say that the act in and of itself hasn't accomplished quite a bit, but in the 52 or 53 years or so that it's been around, it was built to address biological hazards and chemical ones and ergonomic ones, all of the physical kinds of things that we're also accustomed to. And as I said a little bit in the opener, that there are countries around the world, again, last count 36 or 7 of them, that see psychosocial hazards and other hazards as the same thing, with the employer having the same responsibility to mitigate those hazards as they do chemicals in the workplace or slip, trip, fall, those other kinds of hazards. So we are, as a country, just a little bit behind those conversations. I think we're going to catch up quickly. And I think we owe a lot of that to a thing called COVID-19. That's it's actually gonna encourage us to do this a little quicker because there's more conversation about it. And again, to your point, uh, there are businesses, organizations, nonprofits, what have you, who are starting to figure out that how people feel at work is just as important as how they look at work, and how, whether or not their knees and backs are strong, is their spirit strong? Because there are a lot of organizations who, they won't injure you physically, but they'll damage you emotionally in a heartbeat. And sometimes even not even being aware of it. It just doesn't occur that when I say or do these particular things. Because when I started this organization, whatever it was, me and the other person who started, if there was another person, it worked great for me. It was perfect for me. But when I brought on other people, I kind of forgot that they're different from me. And the things that I may enjoy, they may not enjoy. The things that work for me may not work for them. And again, it doesn't, to get out of this kind of value laden discussion and ethics and all this, that's not the point. It's not your intent. It's how people take it. And sometimes they just take it differently from you. And is it free and safe enough for us to just say, that doesn't particularly work for me, but here's something that does? I think those are important conversations. So, uh, so if you were to give me just, your personal assessment of workplace mental health in the United States, what's your what are the highlights or the high points of where you see it today?
Mm, that's a that's a great question. It's interesting. And I know we're going to get into our national certification for employers, but if it's okay, maybe I'll go there now because that's where we get a lot of our learning, right? So, um, I think the interesting thing is that, the mask is off. We're the boundary is been kind of stripped away around having the conversation and putting the attention on, not just mental health, but doing more for the individuals um in your workforce, because it's good for the people and it's good for the health of your organization, right? And to me, that's the conversation we need to have, with business leaders. I think the workplace wellness movement has shifted, thankfully, has evolved, and it has moved away from, we're going to get everyone water bottles, and we're going to do a right, and we're going to like get do a steps challenge, right? All those are good, great things. I love water bottles. And also, and also there is this recognition that if we're going to have, really make a difference, we need to move. It's not just HR's job to have a wellness committee and to identify the benefits. And again, those are all good things. It's everybody's job in the organization to understand what it means to have a healthy work environment, right? So we gather a lot of data. We have an annual big research report, where we gather directly from workers what their experiences are. And really, the first questions are around helping to identify, do you see yourself working in a healthy work environment? Like, does your manager support you? Um, as an individual, can you show up as your full self? All of the things. Do you have all those kind of things in place? Or are you finding yourself in a toxic work environment, a very unhealthy work environment? And then we ask questions about their experience. So that's comparative data, right? So we're constantly comparing in healthy workplaces. What are your experiences around, able to get what you need and the support, and obviously benefits are important, but for us it's about the worker well-being experience. And really what we find, and then we slice and dice across demographics, right? And we found a lot of, there's still a lot of work to do in healthy work environments. There's still a lot of work to do with folks who feel marginalized, folks from different communities. And they'll say, like, even though I work at a great place, I'm still experiencing microaggressions. I'm still, I do not feel like I can actually vocalize what I need. I have a fear of retribution, et cetera, et cetera, right? So so the so that's that's a lot of the research that we're gathering. But we also learn a lot when folks go through our certification process. And so that certification, we're really proud of the fact that it's very rigid. Only about 25% of organizations that apply actually get certified. And it we've mapped it out so that there are levels. So there's platinum, gold, silver, and bronze. And it doesn't mean that, because it's only about 25% who get certified, it doesn't mean that, like, if you're a bronze, you really have a long way to go. As a matter of fact, like, you're on the board, like, you're really doing well. It's all based on a point system and obviously a very scientific rubric. But the idea is for us to really get a sense of, for the organizations that are investing, right, and they're investing in benefits, and we ask questions around culture and leadership. How is the leadership showing up? Compliance, benefits, and really, what is the wellness priorities of the organization, and how is that integrated into the strategy of the organization? So coming out the other side, if you score really high, it's because, yes, you're making sure that there are benefits for around mental health, and support systems, but you've also done everything you can to train your managers so that your managers are doing everything they can to support their teams and understand the emotional intelligence and the safety and the soft skills and everything that needs to happen, right? Because if they're not given the training and the support to support their people, you're not creating a healthy work environment across the board, right? So all of those things have to be, hitting on all cylinders for you to actually get the certification. And what's cool is, it's a mix of, just checking off boxes in the application, but there's a lot of areas for folks to give us explanations of, why they did something differently, or the thing, because people are really proud, especially the HR folks, when they're filling out this application and they have the support of the C levels to invest in this work. They want to tell you all about what they're doing because they're super excited about it. So people get really creative, and people are also finding, executives are finding that I'm investing in this, and the return on investment is, my people recommend to others that they work here. I seeing productivity, right? People are not leaving, or if they're leaving, it's because we've launched them and they want to go off into a great place and we've done everything we could, right? Healthcare costs are lower. Like pick all the ROI buckets. It's not a nice to have anymore to have the health and wellness focus in your organization. It's where we're going is it's integrated throughout the DNA of the organization.
Hmm. Hmm. I'm just again, this is really exciting because so what I'm hearing is this is not just a one-time award, as I described it, this is an ongoing certification of the ways in which organizations focus on the mental health, emotional wellness. Just, is this a nice place to work? And I that is just so encouraging and so wonderful to hear, because as I said, and here's the corollary, is that there are folks out there who will report not a single recordable injury, but it doesn't mean that people don't get hurt. And it doesn't mean that people get hurt. And I'm going to, based on what you're saying, what I don't hear, particularly with the levels, is you can get just across the line. And it doesn't mean that the place is perfect. It just means that the organization is focusing on this and actually wants to get better, because there's another, another ring, another level to get to. So you're kind of encouraging folks to get not only good, but get better and better and become great. And and once you get there, it's kind of like, winning a championship. It's sometimes more difficult to stay there than it is to get there.
100%. And I don't know that there's a there to get, right? I think I
Well,
think
as
we're
in certification
ev-
anyway. Yeah, as in
right, right. Oh,
certification. Yeah, yeah, yeah.
for sure. Yes. But everyone's a work in progress. And I think you articulated that beautifully. You know, this is a process, and we very much want employers, because they can feel overwhelmed, like most of the C levels that I talk to, they have great intentions and they really want to do good things. I'm sure there are some out there that don't have good intentions, but the majority of them do. They feel overwhelmed, and they also do want to know, if I'm putting my money, to be blunt, if I'm putting my money towards this thing, is it going to make a difference in the health and wellness of my people, and is it going to make a difference in my business? Because they want sustainability. If I'm going to invest in this, and it's not like they can't pivot and learn about what worked and what didn't work, but you have to make the case. Like you have to make the case. And we find that, with our affiliates, and because they have workplace programs as well, um, and just with the companies that we work with directly, they take the Bell Seal application questions and they use it as a framework, and we recommend this. So if you just and you can download the questions for free on our website and just have a look and do a serious, honest check-in to say, are we doing, how are we doing in the culture bucket? How are we doing in the compliance bucket? How are we doing in the benefits bucket? How are we doing, in the leadership side of things? And go through it. Don't apply, but use the questions as a check in, and then say to yourself, is this the year that we apply? Or do we use this to identify the priorities that we need to work on this year? Right? And then come back around next year and do it again. And again, maybe you don't apply that year. Maybe you apply again the following, right? So that's really kind of, to me, the thing that I love about it the most is that we are giving you that roadmap and that pathway, right?
Do you need more psych health and safety in your life? Then head over to the Flourish DX Academy for several free on-demand e-learning courses. If you're an internal professional, follow Flourish DX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the Flourish DX Academy. www.45003.org. Now back to this episode.
Right. Yeah, that sounds very familiar as well, because again, it would be very difficult to be in any conversation about safety, about wellness, or whatever, if you didn't believe that somebody out there doesn't care about it. And I believe that people do. I mean, honestly, as much as I can be, as critical as the next person of, these organizations that they're just downright toxic. But the reality is, they're not toxic for everyone. They're toxic for some people. I haven't, because nobody creates an organization and says, "Oh, this is going to be horrible for everybody. Come on and hang out with us." They don't. They don't. So as I say often, I do everything for me perfect, and that's where it stops. It's perfect. It works great for me, but it doesn't necessarily work for everyone else, including, including the the spouse I've been with for 36 years. I mean, not everything I do is perfect for her, perfect for anybody else. So when organizations get created, they get created by people who, in their mind, are doing the things that work for them, but they just don't work for everybody. And particularly for, you know, I, there are a lot of organizations that were built for one purpose and one purpose only, and that was profit. That was it. And whatever it takes, that's just what it takes. And we've, some folks have bought into this kind of binary choice between profit and caring for people, and I don't think they're a choice. I don't. It's a both and. You can do both. As a matter of fact, I'm of the belief, and I don't have a multi-billion-dollar business to be able to prove it, but I believe that the more you invest in the human beings that are working with you, the more profit you're going to make.
Absolutely.
I
Absolutely.
just absolutely believe that.
Absolutely. And that there's evidence around that. There's research around that. Investing in the people retains them, increases their productivity and, turnover rates and the expense of turnover. We all know those numbers, right? You would think the connecting of the dots would be kind of easy around that with the numbers. Yeah. No, I think you're absolutely right. What we say is, you know, they don't have to be competing priorities, right? At the C level, you're thinking about the priorities and where you're spending your time and energy and money. And you're right, a lot of time it does end up of a this or this, and it doesn't have to be that way,
Does
and it
not.
shouldn't be that way.
It doesn't. It
And
doesn't.
I'll tell you, the younger generations, we want to talk about that,
Oh, please.
their expectation. And I feel squirrely talking about it because I'm a Gen Xer, and I have teenagers, so I feel like I can know enough to be dangerous because I have teenagers. I learned so much from the younger generations, and their expectations are completely different, and we have 4 or 5 generations in one workplace now. That is interesting, and I would love to see the conversation shift from, "Oh, no, we have all these generations and no one we need a translator for people to talk to each other." I wanna see it shift from that to, like, what can we learn from each other? Can
That's
we
exactly
set
right.
up reverse mentoring? Can we set up a way that when folks are speaking from, they know they're speaking from a particular orientation point because of how they grew up and the experiences they've had or the experiences they haven't had yet, right? So I find that generational thing super fascinating.
I do as well. I often describe myself as a Gen Zer that was born a few decades early. Because I'm starting to find I really enjoy seeing people uh, have this balanced approach to work life that says, well, if you're not going to be loyal to me, why would I be loyal to you? Explain it to me again. So why would I put in more than I'm going to receive from this experience? Why would I put myself at risk when the company or organization seems not to be interested? All of those kinds of questions, I think they're healthy questions to ask because here's one thing. My doctorate's in occupational health and safety. My master's is in HR. People kind of related things, and both of those, I find that those are two topics. If you want your business to go out of business quick, hurt somebody really bad or treat them poorly. It, None of the other things are going to matter if you can't fix those two.
That's
They
right.
won't.
That's
And
right.
and but unfortunately, there is more conversation in our business schools and about spreadsheets and profitability and ROI and all this kind of thing, and really not enough. I'm not saying that you shouldn't have conversations about those at all. It's important to have a CFO, but the humans that are in these organizations, unless you want to automate everything, and that's an option, that's going to cost you a bit as well. But even if you automate all of the production, don't you still want to have customers that are humans? So understanding humans is just an important thing as long as we have the kind of society that we have. It's just really important. Another question I want to ask you is, so share a little bit more about Mental Health America as an organization, because we were having some conversation early on. I think I may have, matter of fact, I'm certain that I confused you all with there's another few groups
It
out there.
happens.
So tell me a little bit about the history and purpose of Mental Health America in general.
Oh, sure. I love talking about our history. Our roots run really deep in the stigma busting advocacy way of thinking about mental health. So Mental Health America was started by Clifford Beers, who I'm from Connecticut. I was actually from Connecticut. He was a Yale grad, came from a very affluent family. In his early 20s, found himself in, I don't know what the labels were back then, but we're talking about early 1900s, right? Found himself in state psychiatric hospitals. I think he actually was in all of them at one time. One time, Connecticut had three, and through his experiences, and those experiences are documented in a book that he eventually wrote. Those experiences will make you cry and make you, wonder, really what was life like back then, when someone is having um emotional, psychological distress, and it didn't fit within the purview of what life was like back then. Well, you were shifted off to a state hospital, and the fascinating history of those institutions, where once you were there, you're there. Like like your entire life lives on in that location, and in that, and it's literally, they were communities of their own. There's one in Connecticut that I got the tour of, and it was fascinating. They had a cemetery, and for decades, none of those tombstones had names. They just had numbers, because the families didn't want their names. Right? Talk about stigma. The families didn't want their names on tombstones. They rectified that, and now there's this huge plaque. So if you go to, tombstone number 678, it has the family name, as best as they could recover all those records, right? So, I mean, think about, sure, we've come a long way from that point in time, right? But Clifford Beers, again, I think 1908 was when he first founded Mental Health Connecticut, and then he founded Mental Health America, the national organization after that. Um, we weren't called that. It was called something of mental hygiene, the National Society of Mental Hygiene, or something like that. And so over the years, his focus was 100% on letting folks know that if you're living with some sort of distress, this is not the end for you, right? Right, you can live with a mental health condition. You can go about your life, and it can be a part of you. It doesn't have to be the end for you. And shouldn't we start to bring, more, community-based care and support, and just, more public education around, what this can actually be. So the roots are advocacy, public education, and obviously, programs and services, but we're community based, and we do a lot of public policy. Our public policy team is amazing. So we're a lot about, looking at discrimination, looking at, how stigma leads to discrimination in our housing laws, and all sorts of things, right? And that's really, really important work. So our roots are really in just helping folks understand, if you're struggling, and if you're suddenly, thinking like, wait a minute, this is not my everyday, depression, anxiety situation. I think this is something more. How do you determine that, and how do you find the help that you need? So we're very much in the prevention intervention side of things. We're not clinical, although we understand the system, and we understand, right? Um, and one of the directions where this, and I love the leadership of this organization. I love where we're taking things. We're really taking things into the social determinants of health, and the drivers, and understanding, right? To your point, and I feel like you even know more about this than I do, based on the things that you said in this conversation. There are the external factors, and there's different situational things that are leading to how it affects someone's mental health. If someone loses their job, if they find themselves, right, if they're in the foster care system, if they're in a life situation where they're worried about paying the rent, right? Can we focus on the life situation first, and understand what that is like, and solve the root of that? Right. And if we solve the root of that, maybe a lot of this mental health stuff will kind of,
I I
go away.
so absolutely agree. There's a concept I actually heard from one of my guests, and I continue to repeat it, is this concept of fundamental attribution error, where we look at a human being, and we attribute what's going on with them, uh, either if we describe it as positive or negative, we ascribe what's going on with them as something about them and don't focus enough on the environment that the person is in. So you can take two people who are even identical twins and put them in different environments, and different things could potentially happen to them. And particularly when we talk about from a safety perspective. So the definition of a psychosocial hazard in my research is a psychosocial hazard is a psychosocial factor that's perceived or experienced by the person exposed as a threat that in turn affects their behavior. So there are lots of threats in our environment that my brain picks up and says that might be threatening to me, but it doesn't cause me to behave in a particular way because I can quickly, discern that it might be a threat, but it's not a huge threat to me. I mean, so there are cars on the road. They're all over the road. And as long as they don't get too close to my vehicle, they're still a hazard, but they're not that big of a hazard to me because I drive defensively. And so this understanding of the psychosocial hazard environment that the people are in is really important when we talk about addressing their mental health, because constant exposure to threat can affect my mental health. And when you don't think it's a threat, because you think it's okay. This is, back in the day when I was in the fire rescue service for a number of years, and when I started, there were still, you know, uh, magazines and whatnot in the fire stations that had scantily clad or totally naked women and that type of thing. That was what was going on in that culture at the time, but that was a total threat to a woman wanting to be in that environment. A total threat. You walk in and there's someone, you know barely dressed at all, and then you expect me to feel comfortable in that environment, or to have depictions of people who look like me in and things on your wall, your art, that type of thing. And again, whether you intended it or not is not the point. It's how it affects me, and how am I going to be my best self. And if that happens day after week after month after year, I could find myself getting a little depressed and being a little anxious about what that next possibility is going to be, and eventually developing really poor mental health, or even a diagnosable mental illness. So again, I saw that to say that there is sometimes so much focus on the human being and what are we going to do with the human being, and we don't do anything to change the environment. So we just bring the next person in and expose them to the same thing, and then we wonder why it's unhealthy for people.
Yes. So well articulated. And you're just making me think about the importance of really understanding what a human's response is to a situation, right? So if I have to be in survival mode all the time, if my brain is literally clicking on focused on your basic needs and the bare minimum of what you need to survive, which we could have a whole podcast on what that looks like for someone. Great example for you, like a woman stepping into an environment that is, whether the guy's intended or not, but if they're, lack of a better term, gone down the road of bro culture so far that like a woman doesn't feel safe, and maybe she feels okay physically safe, but if she feels like, I can't actually call this out and say, you're actually, impacting and affecting, me as a person, right? So you're in that survival mode, and if you don't know in your survival mode, and then it's day after day after day, so it's like what does it look like to be in thrive mode versus survival modes where
That that
folks, you know,
that's exactly right.
that feels
Exactly
like a
right.
feels like a
So,
t-shirt.
uh, but we still have a few more moments. Could you just in general, are there the criteria for certification? Is it in categories? So could you share a little bit about what some of those categories are? We don't have to cover all of them, but just give me an idea about what some of the categories of things that the certification looks at.
Sure. So there are 4 categories. The first is leadership. What is leadership doing? to create that healthy environment? Are they walking the talk? Are they talking openly? And we don't require that the CEO share their personal story, but they have to, make it a priority in some way, shape, or form. What are they doing to say, hey, this is what I do to keep myself mentally healthy at the very bare minimum, right? And there's other things around, what leadership is doing to create that healthy environment, culturally and like wellness, as far as like what the wellness program looks like, right? So there's leadership and culture, and then there's the wellness program. um, you know do you have an employee resource group? Do you like, what are you doing to make sure that wellness is a priority throughout the organization? And then benefits, of course, you have to have specific benefits that are addressing mental health, short-term disability, all those kind of, there are a lot of interesting things around benefits. um, where, when you talk about EAPs, I don't know how much you know about EAPs. Yeah, that conversation, honestly, we're starting to rethink that, the utilization is so low. I would love to see a complete overhaul of all EAPs, right? It's not working, but for some reason we keep investing in these things, right? So we're actually going to be revamping the Bell Seal in this year, but the certification. But so there's the benefits piece, and then there's compliance piece, like, accommodations, ADA. So those are the four buckets: leadership and wellness, and uh, benefits and compliance.
Okay. Oh, yes. Absolutely. That's and again, it's nice if there aren't like 35. I mean, there's, kind of,
Yeah,
yeah,
yeah, yeah,
four kind of broad categories, and I
yeah.
and I assume that the questioning kind of goes down the rabbit hole on each one of those
It
to
does, it
some
does,
extent.
and
Yeah.
as much as possible, and we're gonna be looking at this more, in 2024, as much as possible, we want those decisions based on employee feedback and what is right. How do you determine what's right for your specific employee population, right? Back to your point about, if I'm showing up, I'm gonna go lean toward what's right for me, but you need to understand what's right for everybody in the
Right,
organization.
right. Absolutely. So that means that you could have two organizations that are both certified, and if you were to look at them, they may look totally different. They may look
Absolutely.
totally different and do totally different things, but they are
Absolutely.
certified based on what works for that group.
Yes. We have a really wonderful case study on our website with Hot Topic. Do you know Hot Topic, the retail organization
I
there?
can't say that I do. Yeah,
Okay.
can't say.
I have teenagers, and I used to go to Hot Topic when I was a teenager, but they're um like pop culture type, concert t-shirts, and they're in every mall across the country, right? um and they really, their customer base is really, kids on the fringe, kids that feel marginalized, lots of LGBTQ, lots of folks that, feel like they quote unquote don't fit in. Like, they have created this amazing supportive culture through their employees and their culture and understanding their customers, where it's like, if you don't fit in, oh, you fit with us, like, you come see us, right? And so they understand that their employees are from that community, and so they have very specific ways of supporting, and a lot of their folks are LGBTQ. They're probably one of the few companies that proudly recruits folks that are trans, and folks that identify trans, and folks that identify from different communities. So, there's this wonderful case study where one of their district managers talks about how one of his managers was struggling a lot, and he talks about the process of what it was like to basically meet her where she was at, and where, and what got her what she needed. And it took months and months for them to get to the point where she was thinking about leaving, and she was, having a lot of personal struggles, and there's a lot of complicated things going on in her life. And he basically stopped everything and shifted the way that they worked together, so that she could get what she needed, kept her job, and now she's thriving. And that store particularly is thriving because she got what she needed so that could become a better manager. And that store continues to bring in, some of the highest revenue. So that's a great example of how it works on all levels. Like, here, the district manager was a human and understood that he had to change how he worked so that he could support her, and they built it together, and then it resulted in benefits for the company.
Wow. Well, there is so much more I could dig into, and that we probably end up in this conversation for hours. But if folks want to learn more about, so let's say there's someone who's out there, they they have some pretty good leadership. They think their culture is pretty strong. They've got some benefit programs set up. They think their compliance, around some of the particularly safety issues is good. And they're interested. They want to learn more about the certification. They want to learn more about Mental Health America. So how would they do that?
So hopefully this is a simple web address, but if you go to our website, mhanational.org/workplace, and that is our workplace wellness resource center. So there are tons of free resources. We have best practices, and depending on the topic, whether it's remote work, or you need, as a worker, you need to advocate for yourself, or you're an HR person and you need to know the policies, right? Ton of resources, and they're divided really along the chain of, like, you're just getting started in this, start here, right? You have a lot of benefits in place, but you're looking to up level your game around workplace mental health, go here, right? And then from that area you can go into learn more about the certification. And so our process is that the certification runs from January to the end of March, and as people apply, we certify as quickly as we can, and try to get those out the door. All of those folks are, they're recognized, as they get certified. We send, national news emails out, and folks get recognized through that, and we give the employers, tools for them to recognize it, and get recognition for, having the certification. They get an actual paper certification. Yep. And then at our national conference, everyone gets recognized. Folks that are certified get recognized.
Right, right, absolutely. And there is a National Mental Health Awareness Month that comes up annually in the U.S. Is that correct?
May. Yep.
Yeah,
May.
absolutely.
Yep. Yep. May is National Mental
Absolutely.
Health Month. Yep.
Absolutely. So this, as people are listening to or watching this episode, will be just prior to Mental Health Awareness Month. So I thought it was a good topic to get people thinking about, perhaps they may want to take this journey themselves. I wouldn't suggest at all that people just dive into something, but this gives them time to kind of see what the criteria is, to think a little bit more about what they need to put in
Yes.
place. And again, as you mentioned, there's some resources that are there to help people. Because again, that's a lot of the conversation. There are folks who want to do, they just don't know where to start. So now they have some resources,
Now they
have a
do.
place
And
to
we
start.
Mental Health America does a mental health month toolkit. And in that toolkit will be some dedicated resources for workplaces.
Absolutely, absolutely. So, Susie, thank you so much for taking time. It again, as I said, when I first found out about this, I started digging around trying to find out how can I get somebody, because I'm sure they're extremely busy, and but I'm so glad you're able to make time to chat with me just a bit. And I've learned quite a bit, and I believe that my listeners and those who may be watching have learned probably more than that. So thank you very much.
I
Thank you very
enjoyed
much.
it very much, David, and I enjoyed the conversation with you particularly, and thank you for putting a spotlight on it.
A-
That's what we need.
abs- Absolutely, absolutely. So, if you're watching this episode on the Flourish DX YouTube page, please do like, subscribe, and share. We want to get the message out to others. If you're watching or listening to the podcast for the first time, welcome. I hope that something you heard will cause you to come back and check us out in the future. Previous episodes of the podcast can be found at psychealthandsafetyusa.com. And please do become a part of the Psych Health and Safety USA movement by connecting to us on LinkedIn. We will certainly look forward to our next conversation on the Psych Health and Safety USA podcast. Thanks very much. Tune in each Friday for new episodes of the Psych Health and Safety USA podcast. If you have a story or know of one that needs to be told, reach out to us on LinkedIn or send an email to david@id2-solutions.com or go to the FlourishDX website at flourishdx.com. We'll see you next time.